Okay, so I think we're live. I think this is working. Let's see. Apologize for any technical difficulties because we've not done a live before. Hello. So thank you everyone for joining. Hi, so lovely. So I'm just going to get Lindsay to join me now. And there are no technical issues. So look, today I'm here to talk about Epionce, which is one of my favorite medical grade skincare lines. I'm so excited to be able to talk to them. Hi, Lindsay.
Hi, how are
How are
you?
you?
I'm good. It's good to see you.
Good. Oh, it's brilliant to see you. It's so nice to see you.
Thanks for inviting us to go live with you today.
Of course. No, I'm so excited. So I was just saying, Epionce is one of my favorite medical grade skincare lines. And I think it's got a really special place in my heart because genuinely it is the first medical grade skincare line that I used for myself. So the first products that I used on my own skin.
Me too. Me too,
Is it
actually.
really? Oh,
Yeah. Now
amazing.
I'm living my 14-year-long dream of actually working for Epionce. So really
Dream
happy
job.
to be here. I know it is.
No, that's so great. So yeah, I guess what I wanted to do today is sort of go through the products that I've used for my own skin, sort of maybe talk about my own skincare journey, talk about the way I've used the products for me and for my family, because I trust Epionce with my family's skin as well as my own. And then sort of about kind of the unique ingredients that we use with Epionce, and again, how powerful and effective they are. So in terms of what drew me to Epionce in the first place, I know it was founded by Dr. Thornfeld, so
hmm
world-renowned dermatologist. He's got 25 plus years of skincare research under his belt.
hmm
He works with patients, so he's actually using these products in his own clinical practice, which is amazing. And I was saying this to you earlier, but when I did my initial training with Epionce, we're actually the only skincare brand that gave me something like this. I pulled this up because I've still got my copy. This
Oh,
is a
yay.
booklet. So the evidence-based clinical care, like the clinical trial summaries, which for me, like with my background in biology and medicine, was so nice to see. I really, really appreciated getting that. And was there anything specific that you used to Epionce originally?
Well, I think the philosophy, really. I had really suffered from acne when I was growing up and in my teenage years, and yet I had quite sensitive, reactive skin, and all of the different modalities that various skin therapists and dermatologists that I had seen were a very aggressive approach, and so the side effects were intense
Yeah.
in terms of treating my acne. I mean, with, just peeling and redness and irritation and sensitivity and side effects from being on, oral systemic medication and just my skin feeling super dry. And I just remember thinking, at 18 years old, like, there's got to be a better way. There's got to be a way to treat the skin that respects the skin and nourishes it, but also still gets the results. And so when I, discovered Epionce, I was actually working in a medical clinic or aesthetic medical clinic, which was my first job out of university, and as a PA for this amazing aesthetic doctor. And so she introduced me to Epionce, and when she explained the philosophy about it being restorative, anti-inflammatory, all about repair, and the promise of delivering results without costing the skin with side effects and just discomfort, was so appealing to me. And of course, I tried it and experienced it for myself. And then the rest is history. I mean, 14 years later, I'm still using lytic gel cleanser and renewal facial lotion every single day. So,
I think that personal experience, it makes a huge difference as well. And again, like you said, that understanding of the skin barrier and respecting the skin
mhm.
barrier and the science behind it is brilliant. So yeah, I guess I can relate in terms of sort of suffering with a few things with my skin. So to kind of go into my skincare and, oh, I think I might have lost you. Hopefully not. I don't know if people can still hear me. Oh, are you
There we
back?
go. Yeah,
Oh,
it
brilliant.
said it
Okay.
paused due to poor connection, but now it's back up.
Okay.
Good old
Um,
technology.
I know. It always happens, doesn't it? You do a live and then there's loads of glitches. So what I was saying was, in terms of my experience with skincare itself, you know, I've always been generally quite lucky with my skin, and that I've never had major skincare concerns. But the things that I've struggled, oh no, I've lost her again. Sorry guys, just bear with us. I'll just wait to see if we can get Lindsay back. But I was just saying, the things that I've really struggled with in the past, it's probably a little bit of uneven skin tone. My skin's quite sensitive. I've got combination skin, so oily T-zone, but then really dry skin and sensitive sort of reddish skin otherwise, which I think I got from my dad. Generally good skin, but my big thing is I would always suffer from acne, like no matter what. Generally my skin would be okay, but I'd always have one spot brewing somewhere, right? And it'd usually be a horrible big cystic acne spot on my chin or somewhere on the lower third of my face that's sore and painful.
Yeah, it sounds really painful.
Yeah, and then it's, you
So
know,
tender.
this horrible cycle where that spot might clear up, but then I've got Asian skin, so I'm quite prone to post-inflammatory hyperpigmentation.
Oh,
I get
yeah.
this reddish brown spot that would linger for months. I try to cover it with foundation, but then because I was using these really harsh, drying acne ingredients that I got, you know, from wherever I could find it, I'd have flaky skin over that
That's the
hyperpigmentation.
worst part, and it makes it
Yeah,
so hard to cover. Or when
yeah. So
you're
then,
when this whatever spot treatment you use, if it makes you all flaky, and then you put concealer on, and then it makes the spot it like highlights the spot rather than
yeah,
concealing it. It drives me
exactly,
crazy.
exactly. So just attracts more attention to that horrible spot. And that was the cycle, you know, and it was so annoying because I'd always have one or two, and they were very noticeable to me, probably not as noticeable to other people, but you know, it knocks your confidence a bit.
Yeah.
And what I've actually done is I've got a couple pictures here, bit embarrassed to show, but it's fine. So this would have, let's see if this works. Okay, so you can see that that's me, no makeup, in the sun. You can see I've got sort of the spots in lower third of my face. I've got a bit of redness, a little bit of pigmentation coming out on the side. It's fine. Like again, my skin overall was okay. And this is me right before I started using Epionce. So again, always a little bit of redness, you could say. Oh, let's see, how do I get out of this?
Your
Oh
picture's
gosh,
gonna
this
be
is
up
what's
forever.
now you're gonna have to stay with that.
But you have the beautiful lips, though. Look at those
Oh,
filtral
thank you.
columns.
And then you can see actually right beneath my lip, I've got a little bit of post-inflammatory hyperpigmentation
Oh,
from
yeah. Okay, I can see that.
a previous spot. Oh, this is okay. Oh,
She's back.
thank God.
I thought you were going to be up there in posterity.
Yeah. So that kind of gives you an idea of like the background of my skin. There's always something like that, right? And I'm quite low maintenance in general. So when it comes to like makeup, you know, I'll want to do my eyeliner in the morning. I don't want to spend a lot of time covering up spots or having to slather on foundation. So that brings me to my first Epionce product, and that is the purifying wash that I started using. So I was a bit nervous sort of in general at the idea of like an anti or a wash that might dry out my skin, because I knew it was formulated for, you know, people that were more prone to acne breakouts, but it hasn't done that at all. So it has a bit of salicylic acid in it, which as we all know is a great anti-acne ingredient because it's anti-inflammatory and chemotolytic. I've got it here. And I've been on this for over a year now. This is my this is just my cleanser. I use this every morning and every night. And I can genuinely say that in terms of maintaining my skin and not getting those breakouts, I haven't had a serious breakout of any kind since I've started using this with the spot treatment, which I'll talk about in a little bit. So it's been really, really brilliant. I was interested in maybe getting you to talk about some of the specific like botanical ingredients that are in the cleanser.
Sure, sure, of
You
course.
don't necessarily see in other anti-acne cleansers.
I think the main one is spearmint. So spearmint is antimicrobial. It helps fight the bacteria in acne, and it also helps disrupt the hormone receptor on the cell. So the trigger that leads to hormonal acne, spearmint interrupts that, and so it helps block hormonal acne from starting. And I think it also gives it the most amazing, refreshing smell. And it's anti-inflammatory as well. So I think spearmint is really the hero ingredient of the purifying wash and the spot gel. And actually, there was a study in the UK where I have to look at it again, but I think it was drinking spearmint tea twice a day was as effective as prescription oral minocycline in reducing acne lesions over a 3-month period. So the power of herbs and botanicals it's proven, it's amazing, and we tap into that with Epionce. And we do use some chemicals, so we do use a little bit of salicylic acid too, but we're all about optimal therapeutic concentration. So we just use a little bit of salicylic, just enough to help clear and prevent those acne lesions, but not dry your skin. And I think in developing a purifying wash, Dr. Thornfeld thought about how global acne really is and how it's not just teenagers with oily, sebaceous skin that get acne. There's a lot of mature women and perimenopausal women that get acne. And so this particular cleanser was formulated to be beneficial across all age groups and genders and sort of acne indications, so that anybody, whether dry or oily, could use this cleanser daily to help clear and prevent those acne lesions without drying their skin out or compromising their skin barrier.
Amazing. And that's what I've found. Again, like my biggest issue in the past with any acne treatment that I've tried is just dries out my skin and then it's uncomfortable.
Me too.
Yeah. And then it doesn't make you want to keep using it, even if you do, get another flare up of something. And then this purifying spot gel has been like my secret weapon, honestly, because I think anyone else who ever gets this horrible, like, again, cystic deep acne lesions, you can feel them brewing, right? Before they
hurt so bad.
Yeah, before they rear their ugly heads, you can feel it sort of brewing on the surface. So that does still happen to me sometimes. I mean, there are a lot of factors that go.
Oh yeah, me too.
Yeah, including like stress. I've been very stressed lately. So this.
Well, you've been working in the NHS.
Yeah.
So hands up. Thank you for your service.
Oh, thank you. I've got a great team that I work with, so I'm lucky. But this just, a thin layer of this at the area where I feel the spot brewing, it seems to just nip it in the bud. And I don't just have those awful like lesions developing, and then I don't have the hyperpigmentation that just lingers for months afterwards anymore, which has been really nice. And then again, I've had this for about I think almost a year now. So it's small, but this is just a spot treatment, right? You don't need to slather it everywhere. It's just targeted for when you feel one of those spots brewing. And it's just been a lifesaver for me. I absolutely love it.
Yeah, it's formulated to rapidly clear or reduce the spot, but also to prevent that post-inflammatory hyperpigmentation. So the red or brown little footprint that we get after having the spot, it helps inhibit and prevent that. So it's just a brilliant multitasking product.
Yeah. And I think one of the things that we were talking about with it is it has sulfur in it, which is an effective ingredient, but I would never know using it. Like it smells really nice. You can smell just the mint and like it smells very fresh and clean.
Yes, the sulfur is micronized. So sulfur has been used over a millennia to treat a variety of skin conditions, but it's not particularly cosmetically elegant. It's usually kind of thick and chalky, and it has that stinky sulfur kind of, rotten egg smell. And so in our formula, we've micronized it, and it's more like colloidal sulfur, little tiny particles of sulfur. And interestingly, they're encapsulated in acacia, another botanical, to help give it a little slip and help drive the sulfur into the deeper layers of the skin. And the acacia is also anti-inflammatory, so it helps with bringing down the inflammation of that spot. And then the spearmint, like I said, is anti-inflammatory. It's broad spectrum antimicrobial, and it inhibits the hormone on the acne-afflicted sebaceous gland. So it's such a multitasking hero botanical in this product. But the spearmint also masks the smell of the sulfur because it smells so minty fresh.
Which is so nice. So yeah, this little duo here have been like absolute lifesavers for me. I will never give these two up. It's just been so brilliant for my skin. But then I guess moving along to the other stuff that I use in my routine. So there's the Lytic lotion, which again, I know is another like absolute rock star product from Epionce. So it's really effective in terms of anti-aging. Oh yeah, you've got it. I need
like a boomerang, like I'll just do a fake boomerang.
I love it. You should do one. So, yeah, so it's the thing that I really like about it is, you know, we hear about retinol all the time, don't we, in terms of like an anti-aging skincare ingredient. But retinol's got a lot of side effects. Not everyone can tolerate it. And what I found really interesting when I first started working with Epionce was looking at some of the clinical studies and actually having the lytic lotion go head to head with prescription strength retinols. And you know, it did pretty well, didn't it? Yeah.
Yeah, in fact, Lytic in combination with the Renewal Treatment Moisturizer was as effective as a prescription retinoid on all epidermal basically markers in terms of like reducing fine lines and wrinkles and just rough texture and things like that. And yet when we looked under the skin, so it was totally equal. It wasn't inferior at all on all those epidermal parameters. But when we looked deeper into the skin and measured it by taking a biopsy, by doing an ultrasound test on it, we found that it had twice the dermal thickening and twice the collagen and elastin induction than the retinoid. So healthy skin is beautiful skin. So by making the skin healthier, suppressing inflammation, fortifying the barrier, and just very gently retexturizing and refining the skin via our Lytic TX, which is essentially a plant-based alternative to tretinoin or retinoids, we can deliver those results without any irritation.
And I think that, you know, the lack of irritation, especially for sensitive skin, is really key because as always with skincare, it's, you know, consistency is key and also sort of patient compliance is key. So you give someone something that makes their skin feel worse, even if it's just temporary at the beginning, you know, a lot of people aren't going to continue with it. And I was telling you about my dad, and this.
Yeah, I was going to say, this is the best story. Yeah. I love this.
This is the product that sold him on medical grade skincare. Because my dad, you know, he's 70 now, and he's got very fair skin. He's English. And he, you know, wasn't always great about sun protection in his youth and isn't the best now despite the constant nagging. But with his very fair, sensitive skin, he was prone to a lot of redness and a lot of dryness. And I would always try to get him to use stuff, and he was just never that interested. I guess a man of his generation doesn't need a skincare routine. But then after a while, you know, the more I was doing work with medical grade skincare, he started criticizing me, and he was like, well, you're my daughter. You're supposed to be a skincare specialist. Can't you sweat? You know, a lot of redness and dryness and flakiness. So I said, okay, but if I give you something, like, you have to use it.
Help me help
every
you.
Single day. Yeah. If I give it to you, like, please use it. So I did. I gave him I think the Milky Foaming Wash. I gave him the Lytic treatment, which has been the star. And then I gave him the Intense Nourishing Cream. And he went away and he used those religiously for a month because I had my mom also monitoring him and making sure he's doing his skincare.
Ensuring compliance.
Yeah. Especially with the Lytic, because you do need that 5 to 7 minutes afterwards to let it fully penetrate to the bottom of the follicles. But he did, and now he's sold, so he's already ordered more. He's so happy with it, and it's actually been really, really nice to actually have gotten him to use some skincare.
That's fantastic. I mean, the fact that he is using it and loving it, I think speaks a lot because, like you said, there's some barriers, sort of cultural, social barriers to sort of a 70-year-old white man being like, I'm going to do a skin regime, you know? And so it just shows, you know, how effective it is that I think he's committed to it so wholeheartedly because he's really seeing the results and loving the benefits.
And it's made a massive difference, you know, to his skin. His skin looks so much better. So again, I feel like once you start using the products and you've had the time to allow them to work, because nothing in skincare is going to be immediate, you know, the results speak for themselves. And that's what gets you to continue using them. So again, this is what I found with when I started using the Epionce products. And I do have another picture to show you later, but it was after 1 month of just using Epionce. And it was in the summer, so it was a time where previously in the past, you know, I'm out hiking, swimming, sweating a lot, so lots of acne, lots of you know, pigmentation coming out on my cheeks. Even though I'm good with sunscreen, I wasn't always the best with antioxidants and that sort of protection because I didn't have a notion about any of that. And then a lot of redness as well. And then just seeing my skin during sort of what is traditionally the worst time of year for my skin, after 1 month of being on Epionce was brilliant.
Mm-hmm.
So I will show that picture. But speaking of antioxidants, I thought I'd introduce the Intense Defense Serum, which I really, really love. So again, this is, it's a really protective serum, isn't it, with all the antioxidants, and then it's got all your vitamins that you need for skin health. So A, B, C, D, and E. And I think it's the only product on the market that has all the vitamins.
All five, yeah.
All five.
And actually it has 23 botanical derivatives of those. So like there's 2 different forms of vitamin C, 8 different forms of vitamin E, 3 different forms of vitamin A, and so on. So everything that the skin cell needs in an optimal concentration is available in the Intense Defense Serum. It's the most complete multivitamin for the skin.
Which is amazing. And it goes on like so beautifully and smoothly as well. It's like
it's really elegant, isn't it? I feel like my makeup goes on better if I apply that in the morning, followed by my renewal and then sunscreen.
Yeah, absolutely. It's definitely a product where it's just like a pleasure to wear, and it's one of my favorites. And I think it ties in really nicely to, I suppose, one of the most important product, which is the renewal cream. So I think there was probably one of the sessions that I did with you where they described it really nicely, where the renewal is really like the foundation, right, in terms of the antioxidants and the protection. This is like your beautiful extra on top, your beautiful like supplementation to your general skin health.
Yeah, basically it is part of the Renew and Fortify range within Epionce, but the Renewal treatment moisturizer, whether it's Renewal facial lotion or cream or intensive nourishing cream, that is like your, well-balanced, nutritious diet. That is the most critical core product to incorporate into any skin regime because it suppresses inflammation and repairs the barrier. When you want to take your results a step further and you're loving Epionce and you also want to add a multivitamin serum to your regime, that's where we incorporate Intense Defense Serum because it will boost the efficacy of the renewal and give you a whole host of other antioxidant and anti-inflammatory benefits while keeping the renewal in place for that barrier fortification and suppression of inflammation.
Which is amazing.
So it's like your food and your vitamin, basically.
Yeah, I like that. That's such a good analogy. And so, yeah, I've used the renewal for myself and I gave it to my mom as well. For my dad, as I mentioned, I gave him the Intense Nourishing because again, his skin's a bit older and a bit drier. So it was sort of more appropriate for him.
Yeah, sorry to just jump in there, but Intensive Nourishing Cream is ideal for that skin type that you're describing of your dad's because for very mature photo age skin, Intensive Nourishing Cream has just a little extra technology to bring the benefits of the renewals. And also because of the azelaic acid that's in it, that helps retexturize a bit. So it's the only product within all of our renewals that incorporates not just the anti-inflammatory and barrier repair technology, but a little keratolytic, retexturize and refine technology as well. So you were spot on in recommending that to your father to help smooth his skin texture.
Oh, good. Brilliant.
Yeah, in fact, now you do like tons of virtual consultations on, is it the Get Harley platform?
Get Harley,
right?
Yeah. So I work with them to do virtual skincare consultations.
Because of all the people that I've trained, I feel like you have picked up on Epionce, just understanding the core principles of it, understanding how to develop a regime, some of the, at the top in terms of almost maybe the fastest person that's ever really incorporated all this that I've ever trained. So I have so much confidence in you engaging in those virtual consultations and putting people on an Epionce regime. So for those that are participating, can you walk us through how that works, how we can book that with you before I'm derailing us because we're going to jump into Daily Shield, but just since it came up, since you're talking about putting your dad on a regime, your mom on a regime, yourself on a regime, it just seemed pertinent.
Yeah, absolutely. So it's super, super easy to do. If you go onto my Instagram bio, onto the link, if you just click on it, you will see a Get Harley consultation link there. And then you can see my availability there. So it tends to be Tuesday mornings and Thursday afternoons to do virtual skincare consultations, and just find a time that suits you best and just book in with me. The consultations are £30, but that is redeemable against your skincare products.
That's good.
you know, we talk about everything. We've got a lot of time. It's not like, you know, a 10-minute GP appointment. Like we will spend a lot of time discussing your skin, discussing, you know, what you've used before, what has worked for you, what hasn't, what your goals really are, and how I can best, you know, get you to your goals. And again, as you can see with Epionce, there's so much versatility in the range. Just briefly, like a couple products we haven't mentioned. My mum, who has really beautiful skin and really doesn't need much with her skin, she does have some hyperpigmentation from sun damage. And we were discussing, I gave her the melanolite treatment, which has been great for her. And again, we were talking about sort of patient selection. So she's someone who really benefited from it because she had overall really good skin. And that was just her biggest concern. And she's someone who's really brilliant and will be consistent with her skincare and, you know, look after it and do everything I tell her. So that's been a great product for her. So, you know, I've just enjoyed it so much that within Epionce and within like getting started, you know, with my training, you know, a year or so ago, I was already sort of seeing like how I could incorporate these things into my own routine and into my family's routine. And then again, like the big thing for me with medical grade skincare is, you know, I would never recommend anything that I haven't either tried myself or, you know, like have some sort of personal experience with and know that it's beneficial and that it's going to work. Like this is what I use for myself and this is what I've given my family, you know, and they've been happy with it. And like we're all, you know, I've got all my Epionce products here. So yeah, Epionce
It's great to have that anecdotal feedback. You know, obviously we have our clinical studies that really back up our results and prove that we do what we say we're going to do, that we truly deliver healthy skin. But then hearing those personal testimonials, those personal anecdotes really, you know, corroborates what we're saying, and it just makes it so much more meaningful. So, and I think your patients, you know, and your clients that are going through the skin journey with you will just have that confidence as well, knowing that you stand behind these products that you're recommending. So you said something when you were talking about the sun damage that you had in the past that kind of brought to my the forefront of my mind one of the benefits of Daily Shield Tinted SPF 50, which I know is one of your favorite products as well that we were planning on chatting about today. So you said that you were always good about wearing sunscreen, and yet you still suffered from some pigmentation when you got sun exposure, and you attributed that to maybe not incorporating an antioxidant into your routine. Now, antioxidants are very important, and the Intense Defense Serum absolutely delivers those. But the interesting thing is there's pollution and there's heat, particularly when it's sunny out. Like you were talking about in the summer being hot and sunny, and heat induces inflammation, and heat-induced inflammation drives unwanted pigmentation as well. And so the Daily Shield Tinted SPF 50 has not just antioxidants, but a whole raft of anti-inflammatory botanicals like rice bran and rosemary and all these other things that help mitigate the inflammation driving skin problems caused by heat. So it's not just wearing sunscreen in the summer, it's suppressing inflammation from between your renewal lytic and your sunscreen that's going to help prevent you from getting that hyperpigmentation from the sun. So I just wanted to point that out because I think that's an interesting thing. And then the other thing is, I think there was a study I can't remember exactly when it was, but in the UK somewhat recently that showed that pollution was actually maybe as much as doubly adverse on the skin as UV. And so the Daily Shield Tinted SPF 50, which is a tinted sunscreen, it's just kind of an even tone, you know, that works for most skin types. It actually, it's like a total environmental shield. It makes this sort of, it's very elegant, but there's like this mesh screen that completely blocks out pollution, like little tiny particles of pollution in the air, as well as the UV and high energy visible light and the infrared, which are, you know, coming from our phones and stuff like that. So it's a very complex multitasking product.
I think that's the best explanation of the product I've ever heard.
Yeah. Well, show them the bottle and show them on your hand so you can see, like.
Yeah. So I think the big thing for me is, of course, there's all the beautiful science behind it that you explained, and it, you know, it's effective in that sense. But for
Hmm.
me, like one of the biggest, so this is it just on the back of my hand, and you can see like it's a really smart tint, isn't it? So like I have quite a different skin tone from you.
Yeah.
We're using the same product. I don't wear
Hmm.
foundation at all anymore. I used to. Since I started using this, no foundation, nothing on my skin but this. And as I was saying, I think the biggest thing that I sometimes struggle with sunscreens is like they are very important, but again, it's like that patient compliance almost.
Yeah,
And
it's
people
yucky
don't
to wear
want to,
them.
yeah, you don't want to put sunscreen on every single day, do you? Especially, you know, sometimes some of the other physical sunscreens, they can leave like a chalky white
Chalky,
cast on your
ashy.
skin.
Hmm.
Yeah. Or they can, you know, they don't feel as nice, but this actually, like, it's a pleasure to wear. Like, it feels so lovely to put on. There's no sort of question that I'm going to be wearing my protection every single day with this. So I found it to be a brilliant product just from that point of view, to like, get people to wear their sunscreen, you know,
Hmm.
not just because of the amazing benefits, but because they actually love wearing it and they
Yeah,
really
they're
enjoy it.
gorgeous. They're just gorgeous products. They're easy to use. They're a pleasure to put on in the morning. It kind of it's like hashtag skincare is self-care. You know, you love putting on. It makes you look good and feel good and know that you're doing good for your body, you know?
Yeah. No, I love it. And I'm going to show you that picture now. So this is a slightly different line from the other picture. So this is 1 month of using Epionce, and you see how happy I am. But you
Yeah,
know,
you can see it
like
in your
yeah.
face. You're like glowing from your heart as well as your skin in that picture.
But yeah, I'm not wearing any makeup. No acne or anything. So those little spots I always used to get, I feel like overall my skin tone has really sort of evened out in general. And again, there are subtle things that you notice with yourself that other people don't necessarily notice, but you notice, you know, slight changes as you age, little lines, little crepiness in your skin. And I could just tell that had all just improved so drastically and dramatically with, you know, the lytic treatment and everything. So for me, again, with Epionce being the first medical grade skincare line that I'd ever used, it was like a revelation. And I'm someone who's always been quite lucky, right? I mean, my skin in general has never been that bad. I can
Hmm.
complain a lot about having one or two zits, but you know, in terms of having major skincare concerns, I've been quite lucky. But even for someone like me, who never necessarily would have thought to use medical grade skincare, like the benefits have been enormous, and the confidence I feel is massive as well. You know, I was with my fiance this morning, and he was like complimenting my skin. He's like, "Oh, it looks so good," and I was like, "Oh, I'm not wearing any makeup on my skin." And again, you know, a year or 2 years ago, I would never not wear foundation because my skin was never, the skin tone was never even, you know, and there's always be a little something that I wanted to cover up. So it's just such a nice thing to have. And the products have just been so, like I said, amazing for me.
It's just so good to hear that feedback and that you're so happy. And I think when a bloke notices how good your skin
Yeah.
is, that's always a good sign. So, well, Epionce is available obviously through your virtual consultations at Get Harley. And when someone has a consultation with you, you design like a very bespoke regime for them, right? And then they get it within a pretty short period of time. It'll be posted
Yeah.
out to them or even couriered to them if they're local, in like a bespoke box that has their name on it and stuff like that, right?
Yeah,
So,
people love the box, and there's always like a list. So there'll be a handwritten card in there for you. And there's always, Get Harley or Brilliant, there's always like a little beautiful extra in there, a little gift for you. So sometimes it's a mirror, or a little bag to keep your makeup in. But
oh, that's
people
cute.
love, oh yeah, they love getting their Get Harley boxes because they're beautifully packaged. And of course, everyone loves getting, you know, gorgeous new skincare products as well. And sort of on that note, I wanted to mention the competition that we were going to do. So I'm going to do a
Oh,
post
yeah.
tomorrow. Yeah. So we're going to give away a 3-step bespoke Epionce skincare plan. So it'll be a free consultation with me. We'll tailor, obviously, the skincare plan to your specific needs and wants. So it's not, you know, just whatever products we have. It will be specific to you. And then that will be done, again, through Get
Sorry,
Harley.
I'm just gonna plug my phone in. There we go.
Fine, don't worry.
Running out of battery there.
So I'm going to post that tomorrow on my feed. And then just to enter, you know, it's the standard sort of Instagram competition. So like the post, tag a friend, the winner will be randomly selected. We'll have all the details in the post. There'll be an opportunity for you to use these beautiful products on your own skin. And again, it'll be tailored to you as well. So we'll have
Yeah,
a
I mean,
chat.
I think a big value of the giveaway is not just the three complimentary full-size products from Epionce, but your time and your expertise walking them through how to get the skin results that they want.
Yeah, so I'm really looking forward to it. I think it'll be great. And I am always so excited to introduce anyone to Epionce and get them using the products because again, like people are just so happy, which always makes me happy. So it's just lovely to be able to give things, you know, give a skincare product to someone that works so well.
Perfect. So, and then will we probably share this live so that anybody who wasn't able to watch on their lunch break can have a look at it and enter the competition and everything?
Yeah, absolutely. So if you joined us late, I'm going to have this on my feed. I'll post it pretty much right after this so people can go back and look again. And, you know, again, if you have any questions ever about any of the Epionce products or skincare questions in general, you can always DM me on Instagram. I'm very friendly and I love answering questions. And you can always book in a full skincare consult with me as well.
And it looks like a few folks have joined us right at the end here. So just to recap for those folks, we were discussing Dr. Emmeline's top 5 favorite Epionce products being Purifying Wash. Do you still have it with you? You can show it.
Oh, yeah.
Purifying Wash, Purifying Spot Gel, Intense Defense Serum, Lytic TX. I've got these. And Daily Shield Tinted SPF 50.
Which I love this one. Perfect. So thank
okay, well, I
you
can't wait
so
to do this again.
Yes,
yeah, thank you for having us.
Perfect. So I will talk to you later. And as I said,
okay.
I'm looking forward to the competition.
Me too. Okay, take care. Thank you. Have a great day.
Thank you.
All
Bye.
right. Bye.